And when I was about 16, I met a doctor named Gerald Benish who said that being a doctor that focused on health instead of disease was the best job in the world because the patients did all the work, the body did all the healing, and all the doctor had to do was take credit for the good results. And I thought, that's the job for me. I had a relative who was a medical doctor, and he found that I was interested in alternative healthcare and became very upset. He said, better I should be a communist spy than an alternative health practitioner. And my father took me aside after he had left and he said, you know, he is very prominent and he definitely doesn't agree with your idea of going into doing alternative medicine. He said, anything that makes him that angry and that mad, well, it can't be bad. So good luck to you, son. I was the first person in my family that ever had to hire a criminal defense attorney to represent me against the accusations of the medical board, and I'd say my father was very proud of that. As it turns out, we've turned from being criminal quacks to cutting-edge researchers, and now the work that we're doing with fasting has gained some notoriety and a little bit more acceptance, and as a consequence, now there's quite a bit of interest. It turns out that fasting is one of the few things that's actually consistently shown to help extend life, both in animal and possibly in humans. And the metabolic changes associated with fasting are gaining significant clinical interest. And now we've been able to actually publish some case reports. Our most recent one was in the British Medical Journal on the successful management of lymphoma. We've had papers on hypertension and other isolated conditions. So, you know, as that information gets out, I think more and more people have become interested in what we've been doing all along with teaching people that health results from healthful living. And healthful living involves eating a whole plant food, S.O.S-free diet, and when appropriate, using fasting. It's dietary excess that seems more associated with problems rather than deficiency for people living in industrialized countries. A whole plant food diet that avoids S.O.S. S.O.S is the international symbol of danger, and it stands for salt, oil, and sugar, including refined carbohydrates, eliminates the dietary excess that's associated with developing what used to be called the diseases of kings, because it was only the wealthy elite kings that could develop these cardiovascular disease, diabetes, cancer, autoimmune diseases, etc. And now, of course, those conditions have become very common. They're almost ubiquitous because now even people of modest means are still living like only kings might have lived in the past, with consumption of very rich, highly processed, what we call pleasure trap foods. Foods that artificially stimulate the dopamine cascade in your brain, lead to systematic overeating. They cause obesity and the diseases of dietary excess. In fact, it is the pleasure trap that's responsible for a lot of the chronic suffering that you're seeing around you. People love good news about their bad habits. And so if you write a book talking about the dead Dr. Atkins diet and tell people they can have their pork rinds and their animal foods, they're going to buy 10 million copies of that book. You tell them the truth, that they've got to eat a whole plant food S.O.S-free diet, it's not going to be quite as popular. Fasting is a biological adaptation. Humans all had to be able to fast because if you didn't, because of our large bulbous brain that uses so much of our fuel, if you were a human and you were in an area where spring came late, you would die. Because we can convert our brain from burning sugar, our normal fuel, to burning ketones, a byproduct of fat metabolism, we're able to go, instead of say like a chimp, a week or 10 days without eating, we can go 70 days or longer. And so fasting is a very natural process. And it turns out if you suffer from the diseases of dietary excess, like if you have obesity, or if you have high blood pressure, or you have diabetes, or you have autoimmune diseases like ulcerative colitis or rheumatoid arthritis or ankylosing spondylitis or eczema or psoriasis or asthma, if you have lymphoma, etc., and you use fasting, you can rapidly undo some of the consequences of chronic dietary excess. How is it that doing nothing can work better than doing anything when it comes to treating these conditions that are the leading causes of death and disability? We have some assumptions that we're making now, and we're testing those assumptions with science. And that's essentially what the TrueNorth Health Center is a human subjects laboratory whose goal is investigating these various aspects that we believe to be true about healthful living and determining if we're doing it as well as we can, or are there things we can do to help our individual patients better. We are already accumulating very compelling data. We have a paper that we published a couple years ago in the British Medical Journal on the successful treatment of lymphoma cancer. In fact, I have a follow-up that's actually in review right now at the same journal showing 3-year follow-up cancer-free status through strictly doing a fasting followed by a whole plant food S.O.S-free diet. Cancer cells hate you when you're in the fasting state. they have a higher metabolic rate than normal cells. They don't do well in the fasting state. And healthy cells are actually protected in the fasting state against toxic effects, including chemotherapy. And if you look at Walter Longo's work, he's showing that, for example, in rat studies, 30 rats that all would die when exposed to a certain level of chemotherapy, you give them the same level of chemotherapy in a fasting state, and all of them survive. There's been some articles published in big impact journals suggesting that intermittent fasting, water-only fasting, and calorie restriction may be one of the most powerful tools that's ever been discovered in terms of helping get sick people well and helping teach healthy people to stay that way. Health is the result of healthful living, and healthful living involves adopting a whole plant food S.O.S-free diet, getting appropriate exercise, abundant sleep. Health is important to the extent that it increases your capacity for happiness. The key, I think, from happiness is understanding the difference between pleasure and happiness. A lot of people think they're the same thing. The bottom line is that if you think you're going to get happy by having more short-term pleasure-seeking, self-indulgent behavior, you may be disappointed. Health is an important part of happiness, but if you want to perceive the overall balance of your life experience as highly positive, you do have to get healthy, but it also involves all the other aspects of life. Happiness is ultimately the driving goal. But pleasure is not the same thing as happiness. Health is the most important component, and health results from healthful living.
Hello, and welcome to episode 6 of the Truth, Health, Freedom podcast. I'm your host, Alan Burton, and today my very special guest is Dr. Alan Goldhamer. Dr. Alan Goldhamer is the founder of the TrueNorth Health Center, a state-of-the-art facility that provides medical and chiropractic services, psychotherapy and counseling, as well as massage and bodywork. He is also director of the center's groundbreaking residential health education program. Dr. Goldhamer is an outspoken, pioneering professional who is deeply committed to helping people stuck in self-destructive cycles reclaim their ability to change their lives. Perhaps best known for his work with medically supervised water-only fasting, Dr. Goldhamer has supervised the fasts of thousands of patients. Under his guidance, the TrueNorth Health Center has become one of the premier training facilities for doctors wishing to gain certification in supervision of therapeutic fasting. Dr. Goldhamer and his team have published numerous peer-reviewed papers on the safety and efficacy of medically supervised water-only fasting, the links to which can be found at his website, healthpromoting.com. After completing his chiropractic education at Western States Chiropractic College in Portland, Oregon, Dr. Goldhamer traveled to Australia, where he became licensed as an osteopathic physician. He is the author of the Health Promoting Cookbook and co-author of The Pleasure Trap, Mastering the Hidden Force that Undermines Health and Happiness. It is my great pleasure to welcome Dr. Alan Goldhamer to the Truth, Health, Freedom podcast.
Nice to be here.
So I'd like to ask you, how, when, and where did your interest in health begin?
Well, actually, for me, it started in 4th or 5th grade when I met Doug Lyle, who's our clinical psychologist here. We grew up together, and he used to beat me mercilessly in basketball. And despite practicing and trying to get as good as I could, I couldn't figure out how to beat him. So I thought if I got healthier, I might be able to get an edge. And I started reading books came across Herbert Shelton. He talked about diet and fasting, and I thought, it made a lot of sense. So I judiciously applied those principles. Unfortunately, it was a complete and total failure because he adopted the same diet, and to this day, he still beats me every time we play. It's really, really awful. So total failure, but it did get me interested in health and healthful living. And when I was about 16, I met a doctor named Gerald Benish who said that being a doctor that focused on health instead of disease was the best job in the world because the patients did all the work, the body did all the healing, and all the doctor had to do was take credit for the good results. And I thought, that's the job for me.
So could you feel a difference at that early stage? You weren't beating doctors.
No, yeah, I couldn't feel a whole lot of differences, at least not in terms of my basketball performance. But I did notice that while other people kind of would have challenges, I seemed to be exempt from those once I got on a healthy program. So I think it did actually help, but it just wasn't helpful enough to be able to beat Dr. Lyle, especially since he was also doing the same program. I think if I could have hid it from him and he had continued to live conventionally, I'd probably be able to beat him. I'm hoping, though, that he might age out slightly faster than I am, so that once we get into that 8th or 9th decade, maybe finally I'll be able to outplay him.
Yeah. Well, I'll keep my eye on it and see
Yeah.
what happens. I was going to say, was there a turning point, a fork in the road? But you've pretty much answered that question. And the next one was, were you ever tempted by conventional medicine? But you've answered pretty much.
Well, no, I had no interest. I had a relative who was a medical doctor, and he found that I was interested in alternative healthcare and became very upset. He said, better I should be a communist spy than an alternative health practitioner. He said, people can't go to them, let alone be one of them. He was so upset. And I remember this was on my 16th birthday, actually. And my father took me aside after he had left, and he said, he is very prominent, and he definitely doesn't agree with your idea of going into doing alternative medicine. He said, anything that makes him that angry and that mad, well, it can't be bad. So good luck to you, son. And he encouraged me. He thought it was a great idea just by virtue of the fact that it made my relative so unhappy. He figured that was proof enough that it was probably a good thing.
And no regrets to this day.
No, I decided to do an experiment and try this for 50 years and see, what kind of the outcome was. And so far, it's working pretty well.
So far, so good. Fantastic. And as your career progressed, did your father's attitude change?
Yeah, well, what I do, particularly with medically supervised fasting, has been up till recently considered very extreme. In fact, I was the first person in my family that ever had to hire a criminal defense attorney to represent me against the accusations of the medical board, and I'd say my father was very proud of that. But as it turns out, we've turned from being criminal quacks to cutting-edge researchers, and now the work that we're doing with fasting has gained some notoriety and a little bit more acceptance, and as a consequence, now there's quite a bit of interest. It turns out that fasting is one of the few things that's actually consistently shown to help extend life, both in animal and possibly in humans. And the metabolic changes associated with fasting are gaining significant clinical interest because they are really quite positive. And now we've been able to actually publish some case reports. Our most recent one was in the British Medical Journal on the successful management of lymphoma. We've had papers on hypertension and other isolated conditions. So, as that information gets out, I think more and more people will become interested in what we've been doing all along with teaching people that health results from healthful living. And healthful living involves eating a whole plant food S.O.S-free diet and, when appropriate, using fasting.
Great. Now, you've just mentioned whole food plant-based, salt, oil, and sugar-free. My last guest mentioned his paleo diet. So what, in your opinion, is wrong with meat, dairy, fish? Why is that not so good?
I'd rather talk about what's right with a whole plant food S.O.S-free diet.
Okay.
The problem is that meat, fish, fowl, eggs, and dairy products all suffer from problems like biological concentration. They accumulate materials from the environment. So a calorie of animal food could have 2 to 1,000 times the concentration of certain chemicals compared to plant-based foods. Animal foods are high in fat and protein. Excess fat and protein have been associated and correlated with conditions ranging from cardiovascular disease to cancer, as well as obesity. So there's lots of challenges, particularly eating too rich a diet. In fact, it's dietary excess that seems more associated with problems rather than deficiency for people living in industrialized countries. So one of the advantages of eliminating the meat, fish, fowl, eggs, and dairy products is usually eliminate all the problems associated with meat, fish, fowl, eggs, and dairy products. On the other hand, a whole plant food diet that avoids S.O.S. S.O.S is the international symbol of danger, and it stands for salt, oil, and sugar, including refined carbohydrates, eliminates the dietary excess that's associated with developing what used to be called the diseases of kings, because it was only the wealthy elite kings that could develop these cardiovascular disease, diabetes, cancer, autoimmune diseases, etc. And now, of course, those conditions have become very common. They're almost ubiquitous because now even people of modest means are still living like only kings might have lived in the past, with consumption of very rich, highly processed, what we call pleasure trap foods. Foods that artificially stimulate the dopamine cascade in your brain, lead to systematic overeating. They cause obesity and the diseases of dietary excess. In fact, it is the pleasure trap that's responsible for a lot of the chronic suffering that you're seeing around you.
So the pleasure trap, how does one escape the pleasure trap?
Well, first you have to recognize it. If you don't recognize this business, it'd be like saying if you don't recognize that alcohol causes alcoholism, how would you be able to escape it? If you don't recognize that you can't solve, for example, alcoholism by telling people to drink moderately or to change just drink beer and wine and everything will be fine. Of course, it isn't. Alcoholics learn that the best way to manage their condition is to avoid drinking. So people that are obese, you can't tell them, well, just change the color of your meat from red to white. Or, you put your food on a smaller plate or chop your food in little bits and chew more and then you won't be fat anymore. You have to tell them, no, you have to stop taking the chemicals that artificially stimulate the dopamine cascade in the brain that leads to overeating and leads to the obesity. And for people that don't have the ability to portion control those highly processed foods, getting rid of them solves the problem. And, that's exactly what we found as we manage people that have these conditions of dietary excess, very similar to the way you would manage people that have addictions of any kind. It works very well. It's just not what people want to hear. You don't go up to an alcoholic and say, oh, your life sucks because of the alcohol, and they immediately go, oh, it's the alcohol. I had no idea. Oh, well, I just won't drink anymore. Thank you so much. They tell you to mind your own effing business. And it's the same thing is true with people that are addicted to the dietary pleasure trap. They really want to believe that it's like McDougall talks about, people love good news about their bad habits. And so if you write a book talking about the dead Dr. Atkins diet and tell people they can have their pork rinds and their animal foods, they're going to buy 10 million copies of that book. You tell them the truth, that they've got to eat a whole plant food S.O.S. free diet, it's not going to be quite as popular.
Okay, that's really interesting. Very clear. Thank you. So you've described dropping the foods that are causing the problem and increasing the good foods that are health promoting. But is that sometimes not enough? Is it? Where does fasting come in here, and why sometimes beneficial?
Fasting is a biological adaptation. Humans all had to be able to fast because if you didn't, because of our large bulbous brain that uses so much of our fuel, if you were a human and you were in an area where spring came late, you would die. Because we can convert our brain from burning sugar, our normal fuel, to burning ketones, a byproduct of fat metabolism, we're able to go, instead of, say, like a chimp, a week or 10 days without eating, we can go 70 days or longer. And as a consequence, it allowed our species to do well. Clearly, we've adapted that mechanism of fasting. That's what we call it, a biological adaptation. Virtually everybody has the ability to change their brain fuel from glucose to fat. And since the brain's our biggest burner of glucose, that's really highly helpful if you get into a period of deprivation. And so fasting is a very natural process. And it turns out if you suffer from the diseases of dietary excess, like if you have obesity, or if you have high blood pressure, or you have diabetes, or you have autoimmune diseases like ulcerative colitis, or rheumatoid arthritis, or ankylosing spondylitis, or eczema, or psoriasis, or asthma, if you have lymphoma, etc., and you use fasting, you can rapidly undo some of the consequences of chronic dietary excess, which kind of makes sense. If your condition is contributed to by dietary excess and you get rid of the excess, it's not surprising that healing is facilitated, and that's exactly what it turns out to do. If you're looking at rats or mice and you systematically underfeed them or you periodically fast them, you can double their lifespan. And although the research is still early, we're actively involved in some of that research, we believe that the same kind of changes are going to turn out to be true in humans as well.
So you're talking doubling the lifespan?
Well, in rats and mice, you're probably not going to double the lifespan in humans. In fact, the number of years you add to life may be relatively limited, but the big difference is the amount of debility. The average American now spends 9 to 10 years disabled and 17, 18 years in poor health in the last couple decades of life, whereas people that live healthily have a much lower risk of having that debility and death. What you're really talking to people about is, yes, you may live a little longer than you would have if you hadn't adopted healthy habits, but you're going to get to have a better chance of living till you die. And instead of spending the last years of your life unable to talk or move, lying in some nursing home bed, waiting for somebody to come and change your diaper, dependent on everybody around you, you hopefully can live a functional life, enjoy the last couple decades of your life, and not become debilitated as a consequence of dietary excess.
So it's the life in your years rather than the extension of years in
Well,
your
and
life.
maybe a little bit of both.
Yeah.
The fact is people that live healthfully do on average live a little bit longer than people that don't. But it's not the difference, the big difference is in the reducing the years of debility rather than theoretically extending the maximum amount of life. It is interesting to note, though, in the United States, first time ever, last 2 years, life expectancy actually going down.
Really?
Yeah, that's the first time ever. And so, it's starting to catch up with us. And, that's a problem. 71% of people are overweight or obese. So now if you're not fat, you're abnormal. You don't want to be normal. You want to be healthy. Healthy people are not overweight. Healthy people do not have high blood pressure. But the majority of people 65 or older in industrialized countries have high blood pressure. That makes it normal, but not healthy.
So that brings me to your motivation, something I've written down here. Is about your goals. What were your goals when you started the TrueNorth Health Center, and what are your goals now? Do you hope to have some influence in perhaps reversing this downward trend in the life expectancy?
Well, what I'm interested in is, number one, figuring out how to do what we do better for my patients. In other words, we want to figure out who's the best candidates for fasting, how to use fasting effectively, how to discover what the best types of feeding patterns are going to work given the individual variations in patients. And we have some assumptions that we're making now, and we're testing those assumptions with science. And that's essentially what the TrueNorth Health Center is a human subjects laboratory whose goal is investigating these various aspects that we believe to be true about healthful living and determining if we're doing it as well as we can, or are there things we can do to help our individual patients better. Now, if the net effect of that has a positive effect on society, that's great. But honestly, I'm not that nice of a person. My main interest is just my patients. And trying to figure out how to do this and how to do it right. I'm curious. I have been curious for the last 40 some years of practice, trying to figure out exactly the best way to be able to pull this off. Now, when it comes to some conditions like high blood pressure, for example, we've published data, medically supervised water-only fasting and treatment of hypertension that has the largest effect size ever shown in treating high blood pressure in humans. And so we've got consistent results. It's not that we don't believe that there may be ways to improve on what we're doing, but we've definitely proven if you have essential hypertension and you want to resolve it, you can go on a medically supervised water-only fast. And if you fast long enough, in most cases, you can normalize your pressure. And if you're willing to do dangerous and radical things like eat a whole plant food, S.O.S-free diet, exercise, and sleep, you can sustain it. And you can sustain it apparently indefinitely. So for conditions like high blood pressure, or type 2 diabetes, we are already accumulating very compelling data. But there's a lot of other conditions out there where we're just beginning to investigate the mechanisms by which this approach seems to be working. One I mentioned was we have a paper that we published a couple years ago in the British Medical Journal on the successful treatment of lymphoma cancer. In fact, I have a follow-up that's actually in review right now at the same journal showing 3-year follow-up cancer-free status through strictly doing a fasting followed by a whole plant food S.O.S-free diet. So we know that it's possible. Now we have to figure out, how generalizable it is and come up with reliable biomarkers to be able to explain how is it that doing nothing can work better than doing anything when it comes to treating these conditions that are the leading causes of death and disability.
And how is this work being received? You've published, I've seen the paper on lymphoma and the paper on hypertension. How is this being received in the wider medical community?
With massive skepticism. It takes an overwhelmingly well done paper to actually get it published because there's a natural knee-jerk reaction that it just seems too good to be true. It seems that something so simple, so low-tech as diet and lifestyle are too good to be true when it comes to treating some of these very seriously ill patients that we manage. So, but nonetheless, there's increasing interest, and we now have affiliations with major researchers and universities around the country that are interested in fasting, thanks to some pioneering work by people like Dr. Walter Longo at USC, our colleague Luigi Fontana at Washington University, and others. There's been some articles published in big impact journals suggesting that intermittent fasting, water-only fasting, and calorie restriction may be one of the most powerful tools that's ever been discovered in terms of helping get sick people well and helping teach healthy people to stay that way.
Okay, now I next want to ask you, you've mentioned earlier that people could fast potentially for up to 70 days. How long do you fast people for in your clinic? And
Well,
what do you think is
As far as duration of fasting, we limit fast to 40 days typically. We don't normally go, you start getting into long fast, that is beyond 40 days on water only, it requires a higher degree of monitoring even than we do to do it safely, because you have more difficulties that can come up in terms of depletion and electrolyte balance, etc. If you keep the fast relatively shorter, that is up to 40 days, we run into relatively fewer problems. It's much easier. The gentleman I studied with in Australia, Alec Burton, used to routinely fast people into the 60 days and longer, but he said he eventually stopped doing that because of sleep deprivation. Not of the patient, but of himself, because he would worry too much about them as they got closer to the, to their limits. So we like to leave a lot of buffer between our patients and a process that's not fasting but starvation. If you fast long enough, eventually you deplete your reserves and you enter a process called starvation. If you continue with starvation, you die. And so we don't like to do that or even get close to that, because it would be really bad on our outcome data.
No, it wouldn't be good.
No.
So there's a physiological
and we've been able to do 16,000 patients so far in the last 34 years, and everybody that's walked into fast has been able to walk out. So far, we've been using our parameters successfully. In fact, we recently published a fasting safety study, and in a peer-reviewed journal, and that fasting safety study evaluated 5 years of consecutive patients, and it showed that fasting can be done safely and effectively when it's done according to the protocol that's utilized by the TrueNorth Health Center.
Yeah, that answers one of my questions I've written down here. What would you say to a concerned friend or relative who's worried that fasting isn't safe? So...
Absolutely. Well, we had a situation some years ago where a very large police officer showed up at the TrueNorth Health Center asking to interview one of my patients, and I asked him why, and he said, I don't need to know. And I said, well, if you want me to introduce you to the patient, I need to know what it's about. And he said, well, the relatives of the patient had called and said they were concerned that they were being held against their will by religious cultists and being starved to death to go to be with Jesus. And I tried to explain to the policeman that the person was there voluntarily, insisted on interviewing him. So I said, that's fine, I'll be happy to have you interview him. But first, could I offer you a nice tall cup of Kool-Aid? And apparently, that's considered socially appropriate. And so the psychologist said, I'm not to speak to authorities anymore. But bottom line was, I thought it was an obvious joke, because Kool-Aid's full of sugar. We're not going to serve that in our facility. But in any case, certainly people's perception of fasting is extreme. They hear Bible stories, Moses, David, Elijah, and Jesus fasting for up to 40 days. I tell my patients they're in good company. What can I say? As far as what I would tell patients is to look at the data. We have a safety study. It's published on our website at healthpromoting.com. They can go on there, they can download the study and look at the actual data. And what it shows is that in a wide variety of patients, including very ill patients, fasting can be done safely if it's done according to protocol. And that's in a controlled environment under medical supervision with a review of history, exam, and lab, and twice daily monitoring. That's what we do. When it's done, it's safe. And we're also showing in our current research that it can be effective as well.
Yeah, the safety aspect is something a friend of mine was asking about as well. So I've written down a couple of questions.
But the thing is, that's in a controlled setting. You can do, in a controlled hospital setting, for example, appendectomy is a relatively safe procedure. But if you teach somebody and have them do it over the internet, the outcomes are not going to be as good. Yeah. So we would recommend that if you're going to have an appendectomy, you do it in an appropriate environment for that. If you're going to do medically supervised fasting, you do it in an appropriate environment that's designed to support that particular intervention.
Yeah, because there's a lot on YouTube of people who are just putting up their videos saying, I've done 40 days, I've done 20 days. And obviously that's something that clearly you wouldn't recommend at all.
Well, we recommend that every patient have a medical history, exam, and lab so that you can establish a baseline so you're capable of telling the difference between a problem and a healing crisis. A positive response generated by the body in an attempt to get well. Without good data, it's very difficult to make that call. And so what typically happens is, if you terminate fast prematurely, you don't get as good a result as you could. If you continue to fast through a problem, you may end up with a serious bad outcome. And I get, of course, a lot of those calls from people that have made really serious mistakes because, they didn't want to follow the protocol. So I definitely advise, if you're going to do prolonged water-only fasting, do it in a facility with a doctor that's experienced, using the protocols that we've laid out. That's what's proven to be safe. If you're going to do something else, then it's like anything. You take your chances.
Yeah. Now, I wanted to ask you about your relationships with, you mentioned Doug Lyle, he's a psychologist. You have a relationship with Dr. Clapper, Dr. McDougall. I know I saw T. Colin Campbell's name on a paper. So what kind of relationship do you have with these various different people, and how does that help you do your work?
Well, we have a large staff at the TrueNorth Health Center. It includes 15 clinicians. So we have medical doctors, chiropractors, psychologists, naturopathic physicians. We have a research team as well with Dr. Myers, who's the director of research, as well as her team. And we have collaborators around the world that are particularly interested in our work with fasting. And so we've put a really nice team of competent clinicians together to help us select and monitor and manage our patients, and researchers that can help us ask and hopefully get answers to the questions that pretty much everybody wants to know, which is, what can we do to help people overcome their illnesses, and what can we do to help people maintain health as long as possible and eliminate the likelihood of debility in the last years of life.
Now, also, you have that team of people. What are the treatments do you have? What are the things do you offer for your patients? You know, it's not just fasting, it's a whole range.
Well, not everybody's, certainly not everybody's interested or a candidate for fasting. So many of our patients come and they're doing modified fasting. They might be doing juice fast, or they may just be doing healthy eating programs, learning to integrate a whole plant food, S.O.S. free diet. Some people are coming because we're a place that they can come. It's the only place they can go for a vacation where they can get healthy food and good education and not have to be dealing with all the challenges of all the energy vampires out there. So we have a variety of patients, from very healthy people that have been doing this for a long time to very sick people where it's all brand new and they're just learning to try to integrate it. The important thing is we take people that we believe are going to have a good result and make us look good. Essentially, we want to select patients that are going to have a positive outcome, so we get positive data, we can have positive influence in their life. And we have the fortunate situation that we have far more people than we're able to accommodate, and so we're able to go through a filtration process so we don't have people coming in that maybe wouldn't be as good a candidate for what we do. The way we do that is we have them go to our website at healthpromoting.com, and they fill out what are called registration forms, which gets me their medical history. Then we offer a no-cost phone conversation to kind of go over their medical history and review if they're a good candidate for what we do, or if perhaps there's someplace that might be a better option for them. We make that recommendation. And then if in fact they're a good candidate, we would make arrangements for them to schedule time. Once they come in, they'll see one of our doctors, go through a full history exam, review of laboratory data. If they're enter into a program, whether it's a fasting program or a healthy eating program, they'll be seen twice a day by staff doctors where we can answer questions, check their vitals, make sure they're adjusting to the process, make sure if they're dealing with drug withdrawal or medication withdrawal, if that's handled properly. And then they're seen at the end by their primary monitoring doctor again, so that advice about what they need to do going forward can be done. While they're at the facility, we have 2 to 3 educational programs a day. So lectures, cooking classes, meditation, yoga, all that kind of stuff is going on. So we're educating people. We have an extensive set of video educational materials people go through at their own pace. Once they're off their fast and back to eating, we have excellent food. We have a great chef. We provide exclusively whole plant food, S.O.S. free food, so people can learn that good food does taste good and they can learn to prepare it and make it. Then we ask people to stick strictly to the protocol until we get good long-term outcome data. So, that's really what the whole thing is about. The biggest challenge isn't getting people well. We're pretty good at filtering out the people that are going to do well and bringing them in, helping them get well. The challenge is when they go home, sometimes there's temptations that lead them back to their old habits. And so the big challenge is developing systems to support people in sustaining a health-promoting diet in a world designed to make them fat, sick, and miserable. Because everywhere they go, people are trying to give them what they want, not necessarily what they need. So we've written books like The Pleasure Trap. We've got S.O.S. free cookbooks like the Health Promoting Cookbook and the Bravo Cookbook. And we've got video educational materials. We're publishing studies. A big part of our foundation, our TrueNorth Health Foundation, is a 501c3 nonprofit foundation. Its mission is public education and research. So we're publishing books. I speak every year at many of the chiropractic, naturopathic, and medical schools doing grand rounds. The doctors that are interested come in and participate in our intern and residency program, where physicians come for a month or 3 months or a year, and they work with our doctors and learn how to use diet and fasting as an important part of their future practices. We have researchers that also come and associate with us, and they participate in our research efforts. So we've got a pretty dynamic process going on. The staff exceeds 60 people now. There's between 60 and 70 inpatients that are in our facility. And each of the doctors also has an outpatient practice. So people are able to do, the interns that come are able to see both inpatient and outpatient care being provided. We also do a lot of phone coaching and phone consulting with people all over the world. So, we're trying our best to reach as many people with the kind of conditions that respond to what we're doing. And the conditions that respond to what we're doing are conditions that are largely caused by dietary excess. So, that's the focus that we're trying to focus on.
Yeah, so you've answered some of my questions without me asking there. So, these reasons why people might fall back into bad health. So that the phone coaching, the education is great for helping to reduce the chances of that, say.
The other thing, when you look at something like fasting, it's very deceptive because you think, how could doing nothing, essentially just resting, have such a profound effect on all these very serious health conditions? So it's worthwhile to talk about different things that happen in fasting. For example, fasting reduces glucose, as you'd imagine. And in diabetics, it reduces insulin resistance. And so now when you start feeding type 2 diabetics after fasting, oftentimes you can get normal blood sugars without medication. Fasting decreases insulin growth factor 1, which has been associated with the aging process itself, as well as increased risk of cancer and other problems. Blood pressure and heart rates are profoundly affected by fasting. In fact, blood pressure more so than any other intervention I think that's been published. Fasting decreases insulin and inflammation and oxidation. It also has a profound effect on that microbial, the microbiota, the microbiome in your body. You've got like 5 pounds of bacteria living in your colon. And they're living creatures, and they're breathing, and they're respirating. They're also giving off waste products. So you got 5 pounds of organisms pooing in you. And if you feed those organisms things like meat, you're going to get more TMA, which becomes TMAO, or trimethylamine oxidase, which is thought to be a highly irritative substance that irritates the blood vessels and leads to heart disease and cancer. If you feed those bacteria soluble fibers, things like sweet potatoes and squash and the foods that you're designed to eat, what happens is you get fertilizer. So you want the 5 pounds of organisms fertilizing you, not making you a toxic waste dump. And fasting, we're investigating this right now, but we believe that fasting affects not just the quality and the nature of the organisms that live in your gut, but what they give off. And so, that's a very hot topic of research right now. Fasting increases a lot of things too. It increases leptin, for example, which is the satiety hormone, the hormone that makes you feel full. And that's why after fasting, you think you'd be voraciously hungry and want to eat everything. But it turns out, no, actually, it's now possible to get your apostatic mechanisms back in sync. It's not just normalizing glucose and insulin, but also some of these other neurochemical changes that appear to be happening at fasting. Fasting increases insulin sensitivity, so the insulin starts working better. People don't realize, but type 2 diabetics actually make more, not less insulin. It's just not working because of resistance, and fasting helps undo that. Fasting affects cellular stress resistance and stress adaptation. That means that, for example, cancer cells hate you when you're in the fasting state. They have a higher metabolic rate than normal cells. They don't do well in the fasting state. And healthy cells are actually protected in the fasting state against toxic effects, including chemotherapy. And if you look at Walter Longo's work, he's showing that, for example, in rat studies, 30 rats that all would die when exposed to a certain level of chemotherapy, you give them the same level of chemotherapy in a fasting state, and all of them survive, and yet dramatically enhance cancer-free survival, according to Walter Longo, publishing in the Journal of Metabolism in 2015. And so there's when you think about metabolic syndrome, the condition that's really, with abdominal obesity and elevated lipids, this is what's really affecting such a high percentage of the population. Fasting appears to affect virtually every aspect of abnormality associated with metabolic syndrome. The conditions of dietary excess respond to fasting in patients that are appropriate candidates and properly monitored.
So that's a huge range of conditions. And you mentioned the microbiome there, and that just made me think of something another friend has been asking. He's got a strong interest in mental health. And I've heard about the connection between the microbiome and your mental health. And then I saw on one of the papers that that was linked from your website that you treated a number of people with depression and anxiety and other mental health conditions. So do you see a difference before and after fasting with mental health conditions? And what might that difference be, and how does that work?
Yeah, of course you do. There's interesting research on fasting in conditions like schizophrenia and other things that have been published, particularly in Russia, Nikolai and others. We treat a lot of patients with anxiety and depression. We ask patients to read a little book. It's called Anatomy of an Epidemic. And Anatomy of an Epidemic has traced the introduction of serotonin uptake inhibitor medications, with raising some very serious questions by looking at the literature on this. And noting that, for example, disability rates are much higher today than they were in 1986, before Prozac and other serotonin uptake inhibitors were commonly used. And the theory is that these drugs may be deactivating the D2 receptors in your brain. And so when you try to withdraw from them, you get anxiety and depression, which leads people to think that they have a biochemical imbalance that requires the ongoing use of these drugs for the rest of your life. And this is not dissimilar to what we see in other conditions, for example, high blood pressure, diabetes, autoimmune diseases. The doctors will tell you, look, here's the drugs you take, and you'll be on these drugs for the rest of your life. Because what they're telling you is if you do what you're told, you'll never get well. They're guaranteeing you'll be sick forever. And we don't question that. We just take the drugs. And the same thing may be true in depression and anxiety, that people can have acute depression and anxiety, can be very debilitating, potentially life-threatening. It's a very serious problem. That doesn't necessarily mean drugs that were originally introduced for short-term intervention should be used on an indefinite basis. However, if you're a drug company, that's great. Once you get somebody hooked, then you can count on a continuous source of income for the rest of their life. The important thing, though, is to recognize that depression and anxiety can often be effectively treated without becoming dependent on medications, including with the use of cognitive behavioral psychotherapy. And it appears that getting people healthy and rested also helps them overcome what in fact is generally a self-limiting condition. You know, an acute depressive episode in 95% of patients over a period of time will resolve. And, you know, there are a small percentage that have persistent difficulties. And so we don't want the fact that a very small percentage of the people may have a condition that doesn't resolve to be dictating the treatment for the vast majority of people that have a self-limiting condition that are now being hooked on drugs that they can't get off of. So one of the things that we do for people that are appropriate candidates and motivated is to help them experiment to see whether it's possible to get them healthy enough so that the need for medication can be reduced and eventually eliminated.
That's really interesting. Thank you. So I wanted to ask you about the stages of fasting, because it's something that I remember hearing in one of your lectures on YouTube. What are these stages, and when do they occur, and what's going on within the body?
Yeah, so there's a variety of different overlapping stages in fasting, and most of them involve the adaptation to the fasting state itself. You know, in the first day or two, you're utilizing your glucose and your glycogen stores that have been accumulated, and then you begin to make a shift, and now you're going to convert to burning ketones, a byproduct of fat metabolism. Your brain will start living basically a little bit of glucose, but mostly beta-hydroxybutyric acid, which is a byproduct of this. Talk about these ketone bodies. And then as you get farther into the fast, the body continues to make this biological shift, so that by the end of the second week of fasting, most of the energy you're being derived is actually coming from fat rather than your normal fuel, which is sugar. And that has some interesting benefits, not just detoxification, but also, for example, hunger blunting, which is how these modified fasting diets also work. If you put a person on a high-fat, low-protein, low-carbohydrate diet, you will have ketosis. You will be in a state of ketosis where you're burning mostly fat, including your brain will be burning fat. And the consequence of that is there's not that much hunger. And so they're utilizing, extending this modified fasting state to aid people in weight loss techniques, and also potentially in the treatment of certain types of cancer and other things where they think that being in this fasting mimicking state may have some benefit. The research on that is relatively spotty and limited, so I think we need to be careful about drawing too many conclusions. But we do know that, you know, the fasting state itself can be very beneficial. I think it's a little more debatable whether you want to sustain that level indefinitely.
So the paleo diet, for example.
Well, the paleo is a high protein, high fat diet, which I don't think anybody that's really thinking real clearly is going to be necessarily advocating. So there are some modifications of that, which are high fat, low protein low or no carbohydrate diets that, have their own limitations, but, at least they're making an argument. The high protein intake, though, I think we can argue pretty vehemently, probably a serious mistake.
As T. Colin Campbell's work would definitely show. Yeah, that's very interesting. Thank you. I wanted to ask you about intermittent fasting and how does that differ, and is it something that you see a value in?
Well, Walter Longo has been doing a lot of research on intermittent fasting. That basically, there's different ways that's described, but for example, narrowing the feeding window to 8 hours a day would give you a 16-hour fast each and every day. And there's a belief that even just 16 hours of fasting is enough to induce some of these metabolic changes that may be associated with improved health. And that narrowing the feeding window may also narrow the caloric consumption. If it results in less intake, of course, that would be highly beneficial. Some people also advocate 1 or 2 days a week, preferably on days when you can rest, that you limit your total caloric intake, say, to 600 calories, maybe what you would get from raw fruits and vegetables only, or various versions of dietary intervention. That may also facilitate weight loss and reversing some of the disease of dietary excess. And then there's people that are advocating short-term or long-term fasting. Whether you do short-term fasting, that is more than 24 hours on water only, or long-term fasting, that's 5 to 40 days, you still would benefit from having a proper medical examination, laboratory baseline, and history, so that inappropriate people would not be doing short or long-term fasting. Even short-term fasting can be deadly if you're an inappropriate candidate, and particularly as it relates to medication use. Taking medications on fasting is rarely a good idea. Most medications have to be weaned before fasting can be undertaken safely. There are some exceptions, but in general, medications can become greatly potentiated. You can create a lot of problems with medications on fasting that wouldn't necessarily be a short-term problem feeding. So in order to determine if a person's a candidate for fasting, you have to really have a doctor that's not an idiot, review their history, and give them good advice. You also want to have baseline data to make sure that there's no contraindications to fasting, and appropriate monitor during fasting so that the fasting is a safe and effective experience. People have to be in a resting state, and they have to come off the fast carefully. Particularly in longer term fasting, if you refeed inappropriately, you can get even seriously ill or even die from refeeding syndrome and other complications that can arise. Very commonly, post-fasting edema, other issues that will come up if that refeeding period, probably the most important part of fasting, is that initial refeeding isn't done appropriately. That's where most people that get into trouble with fasting get into trouble. It's not even the fasting so much as it is initial refeeding, and that's where we can get into really serious problems.
So how do you approach that refeeding at TrueNorth?
What we do as a general rule of thumb, well, first of all, again, there is some individual variation depending on the patient, their history, and their condition. But general rules of thumb is for every week of water fasting, there's usually a day of fresh juices. So a person that has a 3-week fast might be on juices for 2 or 3 days. The reason for that is the juices we want to get about 600 calories to start shifting out of the fasting state. And you can't get 600 calories when there's a lot of fiber involved initially because of the satiation mechanism that go along with fasting. So it's a way of recalibrating, getting enough sugar in to get the caloric needs met, but not the fiber that might cause some digestive challenges. Then we'll progressively begin introducing fresh raw fruits and vegetables, so that for every week of fasting, generally there's a day or so of raw fruits and vegetables used. So again, a 3-week fast might have 2 or 3 days of juice, 2 or 3 days of raw food. Then we may introduce some more concentrated foods like steamed vegetables, eventually some tuberous vegetables. If those go down okay, we may introduce some grains or legumes if those are appropriate for the patient's small quantities of nuts or seeds. Our diets are exclusively whole plant foods, S.O.S. free diets, so we never introduce meat, fish, fowl, eggs, dairy products, oil, salt, or sugar. We also don't typically use gluten in any form just because so many people seem to be sensitive to the effects of those proteins. So the grains that we use tend to be the non-glutinous grains. And again, some people, maybe they don't do so well with lectins or grains or beans. We'll use starchy vegetables. Some people do better with a higher proportion of steamed vegetables rather than raw vegetables if they're overcoming some inflammatory bowel conditions. Sometimes you have to limit how much, say, fresh fruit is in the diet if a person's diabetic and they have some trouble still regulating blood sugar mechanisms, depending on how long they fasted, if they're at optimum weight or not. So again, the diet has to vary to the patient. We don't try to smush everybody into exactly the same dietary pattern, but the diet in our facility is always a whole plant food diet that's free of added sugar, oil, and salt.
Okay, and if you have a patient who has, in the past, developed a dietary, a disease of dietary excess because he's eating too many of those more harmful foods, and then he goes to your clinic, he does a fast, and then he's reintroduced to these foods. How does he react? Because it can be very different to what he might have been eating before that caused the
Well,
problem.
actually, taste neuroadaptation happens in fasting, so your tastes become much more sensitive. So sometimes we're real fortunate, like the soup, the salty soup that they used to get at the restaurant they thought was so good is now so perceived to be so salty they don't even want it. It has a burning type of thing, which is really interesting. It takes about a month on a low salt diet with feeding to neuroadapt, but with fasting it happens much quicker. Now they can actually taste the salt in things like chard and tomatoes and celery. And as a consequence, it's easier to get them to eat well because they like the taste of food. The food that's tasteless swill when they come in, disgusting, awful, that they couldn't imagine ever eating. Now all of a sudden it gets to be not bad and actually eventually good. And so that change is really exciting because now it's much easier to make the decision not to eat the self-indulgent, highly stimulating foods that they're used to eat. Also because their blood sugar and their blood insulin levels tend to be more stable. They don't have the cravings and sometimes the overwhelming impulses that tend to drive them to try to quiet that painful experience. So I think fasting can be very helpful at helping people make diet and lifestyle changes, but ultimately people are often addicts, and when they go home they're tempted, and if they indulge in it, sometimes they have to cycle through the process again because this is not a cure, it's a management strategy. You can't cure obesity, you can manage it. You can't cure hypertension, you can manage it. And you can't cure cancer, you can manage it. So the reality is you may manage it so well it never becomes a problem in the person's life again. Or it may be a situation where they do well for a period of time and then they backslide, and that's a very natural and unfortunately difficult process. That's why we're looking at scalable types of support to improve the percentage of people that are able to make and sustain these changes.
And the salt, oil, and sugar in this food, you mentioned how you can start to taste the salt in the celery and such things. Right. What is it about the salt, oil, and sugar that
well, salt, oil, and sugars we're talking about are chemicals added to food. They're not actual whole food. They're just isolated, fractionated chemicals added to food. And that's where the problem comes in. So yes, you're going to get all the sodium you need. You're going to get all the carbohydrates you need. And you're going to get all the appropriate essential fatty acids and protein that you need. But you're going to get it from your whole foods and not from the highly concentrated pleasure trap, chemicals that we add to food that have a drug-like effect. So we're just getting rid of the drug-like effect. We're not getting rid of the fact that you're going to get all the raw macro and micronutrients that you need to sustain health.
So it's food, not drugs in this case. I wanted to ask you now, coming towards the end of the interview, and I wanted to ask you about what you do each day, apart from eating right and not having salt, oil, sugar, etc. What things do you do on a regular basis to maintain your optimum health?
Well, I'm very fortunate because I live and work at the TrueNorth Health Center. So, 20 of my 21 meals a week are eaten at work. So we have, our oatmeal and fresh fruit and greens in the morning. We have huge salads, steamed vegetables, potatoes, rice, and beans, whatever's appropriate that day, small amounts of nuts or seeds. And we're not really tempted because the only food that's available easily to us at the TrueNorth Health Center is health-promoting food that's made fresh by our fabulous chef. The challenges I run into, and of course, in addition to diet, the other really critical issues are high quality sleep. So we always want to sleep in a cool, dark, and quiet place and get enough recuperative sleep to wake spontaneously feeling refreshed, and appropriate exercise. Now, what I advocate for patients to do is a variety of activities: walking, hiking, biking, swimming, dancing, stretching, and not necessarily just one activity, which tends to lead to repetitive use injuries and problems. I have to admit, though, in practice, although I do some of the other activities, I spend 8 to 10 hours a week playing full court basketball because I love basketball. It's one of my passions. And I, again, working very, very hard trying to someday get better than Dr. Lyle.
One day.
And so I get up at 4:57 each morning and go to the place that I play basketball with the group of people that I play basketball with, and we play from 5:30 to about 7:15, and then shower up, go to work, and I work, from about 7:30 to most days 6 or 7, And during that day, I have breakfast, lunch, and dinner at work and see patients and do the things that I do with our foundation. And then the only other activities I really engage in regularly is I do some hiking with my wife. She's not a real big basketball player. Do a little bit of resistance training, do a little bit of stretching, but mostly I work, I play basketball, and I eat a healthy diet. The challenges that I run into is actually I do a lot of traveling. So I speak for nonprofit groups, I speak to the medical schools and the chiropractic colleges, the naturopathic colleges, and then it's a much bigger challenge. Fortunately, I know that you don't have to eat in any given day to survive. A lot of my patients think if you get on a plane in New York and you flew all the way to California, you would die somewhere over Colorado from starvation if you didn't eat the peanuts or the pretzels or whatever it is they're giving you on the plane. So what I've learned is it's always not a bad idea to try to find some healthy food that you take with you. We always try to have a place we can have some control of our own food. I've started to learn where you can go to get things that are health promoting. For example, if you go to many Thai restaurants, you can find they have steamed vegetables and brown rice. You can order off the side dishes and you can do quite well. If you find sometimes steakhouses, you can get some baked potatoes or baked yams and some steamed vegetables. And you find there's many places, even sometimes at the airport, you can find places that you can get something that's actually edible if you know who to ask and how to ask and who to bribe. And so, you develop strategies, but traveling definitely is more of a challenge than living at the TrueNorth Health Center where there's no shopping or chopping or effort that's required.
That's what the staff are for. Okay. And you mentioned challenges there. So I wanted to ask you, what have been the biggest challenges in your life and how have you overcome them?
Well, I think, the social pressures are challenges for everybody that are trying to live healthfully. For us, the legal threats, I really didn't particularly want to go to jail. And so, I'm just thrilled to be living free and being able to do what I'm doing without, any current threats from that type of problem. Running a nonprofit facility that does fasting supervision at affordable rates is always a challenge. Just in terms of we have, 60 employees and all the things that go along with making that happen, and particularly trying to make it happen where it's affordable. And I think that's one of the things that I'm very pleased about is we've been able to preserve much more affordable rate structure as a consequence of improved efficiencies, and so that most people that are even of moderate income are able to afford to have an experience at the TrueNorth Health Center, which is really good because many of the facilities are so expensive that unless you have really unlimited resources, it's very difficult to spend any significant amount of time. And sometimes it takes time. Not everybody can do it on their own. Many of our patients do. They read the books, they watch the videos, and they're able to make the changes. Some people need a little bit more help than that. Some people need a lot of help. And some people, no fault of their own, they have very serious conditions that require some more aggressive intervention in order to be able to be successfully managed. And so we've created a situation where we can provide that care and we can research it and hopefully create some legacy in that regard, figure out how to do what we're doing better.
Great. And these books and videos, this is important for me because I'm in England, you're in America. For people that I know who can't get to the TrueNorth Health Center, what are these books and videos that they can access?
Well, I would definitely encourage reading our book, The Pleasure Trap. The Pleasure Trap subtitle is Mastering the Hidden Force that Undermines Health and Happiness. It's the reason why people are fat, sick, and miserable. The first 2/3 of the book explain why it's so difficult to do this, even though it makes sense. The last third of the book talks about fasting and how fasting might be a helpful tool to make doing this a little bit easier. So I think that's a good, important book that summarizes a lot of these principles and really helps people understand what we're really talking about when we talk about why a whole plant food S.O.S. free diet can be such a useful tool. We also have our 2 vegan S.O.S. free cookbooks, which are great because you have recipes that even I can make them. Simple recipes with commonly available ingredients, but actually taste good and look good, but don't use and rely on sugar, oil, and salt or gluten in order to be able to be healthful. And of course, they're all exclusively whole plant food recipes. And that is the Bravo cookbook, named after our fabulous chef, Ramses Bravo, and our original book, The Health Promoting Cookbook. We also have a really great website, healthpromoting.com, that has all of our studies and articles freely available. There's the Learning channel. There's TrueNorth TV, lots of videos and webinars and things that people can access. And also we offer this free phone conversation if people want to have a discussion about whether fasting is appropriate for them or if we can be of any use to them. They can fill out the registration forms and give me a call, and I'll be happy to speak with them and give them the best advice that I can.
Fantastic. Thank you. Now, I have one final question for you. If you could give one last talk, so it's the last time you can give an interview like this, it's the last time you can give a lecture that you can put out there to the world, what would you want to say? What would your message to the world be?
Well, I would say that health is the result of healthful living. And healthful living involves adopting a whole plant food S.O.S. free diet, getting appropriate exercise, abundant sleep, and that, health is important to the extent that it increases your capacity for happiness. But that, happiness, the key, I think, from happiness is understanding the difference between pleasure and happiness. A lot of people think they're the same thing. And pleasure is, really more of a dopamine response in the brain. And happiness is really a different neurochemical event, really more associated with serotonin, et cetera. So the bottom line is that if you think you're going to get happy by having more short-term pleasure-seeking, self-indulgent behavior, you may be disappointed. If you want to get happy, you have to remember that health is an important part of happiness. But if you want to perceive the overall balance of your life experience as highly positive, you do have to get healthy, but it also involves all the other aspects of life. And so happiness is ultimately the driving goal, but pleasure is not the same thing as happiness. Health is the most important component, and health results from healthful living.
Wonderful. Dr. Alan Goldhamer, thank you very much.
Very good. Nice talking with you.
Thank you. Bye-bye.